Tonight, we want to ask questions about IMPD's response to mental health calls.
There has been recent concern on how IMPD is responding to these kinds of incidents. Mental health concerns or even a crisis are certainly not uncommon. We went digging today and we want to show you some of the numbers. The National Association of Mental Illness says 1 in 5 American adults experiences some form of mental illness any given year, and 1 in every 20 adults is living with a serious mental health condition. Experts say many people aren't sure when and how to speak up and ask for help. So 13 Investigates has been digging into those responses, and Karen Campbell joins us live here in studio. And Karen, despite the concerns, there is a program here to help on these very types of calls.
Yeah, there is a program, and the experts I spoke with today said a lot of people don't know just how many programs there are and how long they've been around. So the one that we're talking about tonight within IMPD has been around for 5 years and started over in the East District. Officers there say they're part of what's called a crisis intervention team, partnering with a clinician to respond to certain 911 calls. Their goal, provide a person in need of help with resources and help keep them out of jail. Sergeant Lance Dardine with IMPD's Mobile Crisis Assistance Team, or MCAT, loves his job.
Seeing somebody that's not in services and having barriers to success finally get into services, and I had something to do with that, honestly, it's pretty emotional.
He's part of a team of 9 trained IMPD officers and 9 clinicians from Eskenazi Mental Health Center who work together to respond to 911 calls, from substance abuse to mental health.
We're trying to help as many people in the community as we can. So those are critical incidents.
This is just one of many programs within police departments in central Indiana.
Mental health professionals literally are embedded with police officers.
Kimball Richardson is a licensed mental health counselor at Community Health Network. He's also a member of the Marion County Crisis Intervention Team. They help educate law enforcement officers on mental illness.
We're trying to teach officers just little points here and there where they can make a difference and intervene in a conversation that might help de-escalate a patient or a citizen.
Two, was that? But MCAT works from 8 a.m. to 6 p.m. So what happens when someone needs help after hours?
Let's say that an officer gets on scene and realizes, hey, this may be a mental health issue. They can definitely reach out to us over the phone or the radio, and we can respond.
Richardson says callers should be as specific as possible.
Ask the dispatcher for a CIT officer, and dispatchers will know what that means.
It's an officer who's gone through a 40-hour training on mental illness and addiction. And Sergeant Dardine says that training really makes a difference when they go out into these communities. And again, we want to just stress the importance of anyone needing help. When you pick up the phone to dial 911, be specific and ask for that CIT person to come out and assist you.